Hello everyone, welcome to Mediverse, and today we are going to discuss again an important question, that is blood pressure, which is an important topic in physiology. And in this video we are going to discuss BP under the following headings. Firstly, we are going to discuss what are the definitions involved in BP. Then we'll be discussing the physiological variations in BP, and then we'll go for the what are the factors that are affecting the blood pressure. So this will be the three headings that we are going to cover in this video, and in the part 2 video we'll be discussing the regulation of BP, that is short term regulation as well as the long term regulation of BP. So we know very well what is BP, right? We see many of our elders who say that they are suffering from high BP or they are suffering from low BP. But what exactly is BP? Yes, we know that high BP means, so before you say high BP or low BP, you need to know the exact normal range of BP. That also we know very well that it is about 120 by 80, right? So what is this 120? This 120 is the systolic BP, whereas this 80 is the diastolic BP. That also we know very well what is systolic and what is diastolic BP. But in this video we are going to learn how exactly this BP generated, how does this blood pressure form, okay, how is this pressure occurring. That is what we need to understand in this video. So without wasting any time, let us jump to the topic. So what is blood pressure? It is the lateral pressure that is exerted by the column of blood on the wall of arteries. So basically, if you assume this to be blood vessel, and let us assume this red color to be blood. So whatever the pressure the blood is exerting on the wall of the arteries of the blood vessel, okay, that is what we call it as blood pressure. So it is the lateral pressure that is exerted by the blood, okay, that is what we call it as blood pressure. Then what is systolic BP? We know very well that is 120, right? 120 is the systolic BP, but that is just to remember, that is 120, but it is the maximum pressure that is recorded during the cardiac cycle, okay. So in the cardiac cycle there are various pressure and volume changes, right? So in the pressure changes, there is maximum pressure at one point and there is minimum pressure also. So the maximum pressure that is recorded during the cardiac cycle is named as systolic pressure, BP, okay. So we know very well that it is about 120, okay. Out of 120 and 80, this 120 is said to be the systolic BP, but that is the value. What is the range? It ranges from 100 to 119. So if the person is having 101 as the systolic BP, then you are supposed to say that the person is normal, because that is also a normal range, okay. So 100 to 119 mmHg is normal in adults. So this is the range of the systolic BP, whereas the diastolic BP, on contrast to the systolic one, it is the minimum pressure that is recorded during the cardiac cycle, okay. The range is about 60 to 79 mmHg in adults, okay. Then we'll come to the another definition, that is what is pulse pressure. So pulse pressure, it is nothing but the difference between the systolic and the diastolic BP, okay. So whatever the difference you get, if you subtract the diastolic one from the systolic one, that is we get the difference is 20 to 50 mmHg. That is what we call it as pulse pressure, okay. I hope this is clear. Now let us come to the another important term, that is what is mean arterial pressure. So the mean arterial pressure is nothing but the average pressure that is recorded during the cardiac cycle. So what is the average? How do you calculate the average pressure? That is nothing but the diastolic blood pressure plus 1/3 of the pulse pressure. So to know the mean arterial pressure, you are supposed to know pulse pressure. That means to know the pulse pressure, you should know the systolic pressure. So in order to know the mean arterial pressure, we are supposed to know the systolic pressure, diastolic pressure, pulse pressure. So by knowing these three values, we'll come to know what is mean arterial pressure, because diastolic pressure is needed, and to know the pulse pressure we need to know the difference between the systolic and the diastolic pressure, and 1/3 of pulse pressure is taken into the calculation. That is how we calculate the mean arterial pressure. So what is the normal range of the mean arterial pressure? That is about 75 to 105 mmHg. So this is the normal range of mean arterial pressure. Okay, let us come to the next heading, that is the physiological variations in BP. Okay, so in different individuals the BP will be different. So by seeing that, you're not going to get confused that this person is having less BP or more BP. So there are variations in individuals. What are those variations? The first variation is age. So the children will have low BP. Okay, the children will have less BP because of the less blood volume. Because if the blood volume is less, then the blood pumped will be less from the heart. So because of that, there is less blood pressure. Okay, that's why it is said that the BP increases with age. Adults, on contrast, they'll be having more blood volume, and hence they'll be having more blood pressure. The second factor is gender. Okay, gender, same as usual. Females have less blood volume compared to males. Okay, that is why females have less blood pressure compared to males. And what are the other reasons why females have less BP than males? Is because during menstrual cycle there is loss of blood. That is one factor which is not seen in males, right? That is one factor. And the second reason is because effect of progesterone. This hormone, it is mainly released more in higher quantities in females. Okay, that relaxes the smooth muscles. Okay, the smooth muscle of the blood vessel is relaxed. It shows the vasodilatation effect on the blood vessels. Hence, the progesterone, which is secreted more in females, it shows decreased BP. That is the reason why the BP is comparatively lesser in females, because of the action of this progesterone. Okay, and the third reason is because estrogen. Okay, this is not that important, but if you want to remember, you can, that the effect of estrogen is it prevents atherosclerosis. So how is atherosclerosis prevented? By vasodilatation. Okay, so these are the reasons why the females have lesser BP. And the third reason is eating, after eating. So what will happen after eating? Blood pressure increases after the meal. Why? Because of increased body metabolism. So after the meal, your body increases the circulation to get the food digested. That is the reason why the blood pressure has to increase. Okay, so cardiac output increases. Okay, because of that BP also increases. So more is the cardiac output, that means more is the blood volume and more will be the BP. Okay, that is why after eating, after the meals, the blood pressure usually increases. So the fourth factor that we are going to discuss is sleep. So what will happen during the sleep? The BP is less during the sleep. Why it is less during the sleep? Because lack of stress and strain. So the stress and strain, it will stimulate the sympathetic stimulation of our body, and it will increase the sympathetic discharge, thereby increasing the blood pressure. But whenever this sympathetic stimulation is absent, because there is no stress while we sleep, okay, so there is no sympathetic stimulation, there is no increase in BP, so the BP will remain low. And because of lack of any physical activity, so due to lack of physical activity, there is no much blood required by the body. That's why the BP will be less. Okay, another factor that we are going to discuss is posture. So what is the posture? How does the posture affect BP? This is very important. On immediate standing from supine position, BP decreases due to venous pouring of the blood in the lower limbs. So what they are trying to say is that, so what happens when the person immediately stands from the sleeping position or the supine position is that the blood which is there in the body, it will get diverted to the lower parts of the body, that is in the lower limbs. Why does it get diverted? Because of effect of gravity. So when the person stands, the blood, when the person changes his position from the supine to the standing position, the blood drains to the lower part of the body because of effect of gravity. So because of that, there is decreased blood pressure for some time, but this is not permanent. This is only for some time. It is temporary because it is corrected by baroreceptor reflex. So this we are going to discuss in the regulation of BP, how this is going to balance the change in the BP, that we are going to discuss. Okay, but you need to remember that while immediate standing from supine position, blood pressure decreases because of pooling of the blood in the lower limbs. Okay, and the next factor is exercise. So what happens during exercise? The systolic BP increases, but the diastolic BP decreases. Now they can ask you why the systolic BP increases and why the diastolic BP decreases. So the reason is the systolic BP increases due to the high venous return. So during exercise there is increased demand of oxygen. That's why there is increased venous return to the heart. So the heart requires more oxygen. More oxygen means more blood. So there is more venous return to the heart. So because of that there is increased stroke volume. Because of that there is increased cardiac output, and because of that there is increased BP. So cardiac output, more the cardiac output, more will be the BP. So this is how the systolic BP increases. Now then, why is diastolic BP decreasing during exercise? Why it is increasing? Why it is decreasing? It is because of the effect of vasodilatation. So what happens is during the exercise there is increased body temperature, right? So there is increased sweating. That means there is increased body temperature. So because of increased body temperature, our body naturally compensates the increased body temperature by vasodilatation, that is relaxation of blood vessels. So because of the relaxation of blood vessels, there is the diastolic BP decreases. Okay. The next one is temperature. So we have partially discussed temperature in this only, but again, so temperature BP decreases in hot temperature due to cutaneous vasodilatation. Now as I have discussed above, and vice versa. Vice versa means BP increases in colder temperatures. Why? Because of vasoconstriction. Why does vasoconstriction occur? So in the colder temperatures, what will happen? In the colder temperatures the body will tend to have more blood pressure, because by the help of vasoconstriction. Okay. Now what is the another factor that is going to affect BP is pregnancy. BP increases during pregnancy. Now I think you all have guessed the reason for that is because of high blood volume. So we have already discussed that if the blood volume is more, then the blood pressure will also be more. So because of increased blood volume, the BP also increases. Okay, and cardiac output is also increased because of increased blood volume, and that is why the BP increases. So these are the variations that we have discussed in the physiological limit. Now we are going to discuss what are the factors affecting BP. So we'll not take much time to cover the factors affecting BP, because the factors that are affecting the BP are the factors that are affecting the cardiac output. Whatever factors that affect the cardiac output are the factors that will affect BP. That means there is a relation between blood pressure and cardiac output. What is a relation? So the blood pressure can also be defined as the product of cardiac output and peripheral resistance. We know what is cardiac output, that is the blood that is pumped by the heart. Okay, that is cardiac output. Okay, whereas what is peripheral resistance? Opposite to the BP. So peripheral resistance is the resistance offered by the blood vessels to the blood flow. Don't get confused. Blood pressure means the blood is exerting pressure on the vessels, whereas the peripheral resistance is the pressure, the resistance, or it is also a type of pressure that is exerted by the blood vessels to the blood flow. Both are vice versa to each other. Okay, so the cardiac output multiplied by peripheral resistance is blood pressure. Okay, now whatever factors that affect the cardiac output will affect BP. Whatever the factors affecting the peripheral resistance will affect the BP. How they are going to affect, we'll observe here. So what are the factors affecting cardiac output? One is preload, other is afterload, other is force of contraction, and the fourth one is heart rate. Okay, so all these factors we have discussed in the cardiac output. Okay, so whatever, if you are not familiar with the terms, then you have to watch cardiac output, then only you can understand BP clearly. Okay, so we are not going to repeat the discussion again. So what is preload, what is afterload, what is force of contraction, and heart rate, all these factors we have already discussed in cardiac output. The same factors are directly proportional to BP. So more is the cardiac output, more will be the BP. So if these factors are changing the cardiac output, that will also directly affect BP. Okay, now what are the factors affecting peripheral resistance? So what is peripheral resistance? We have already discussed there. So how does it affect, on what factors that peripheral resistance depend is on diameter of the blood vessel. So what is diameter? That is this is the diameter, right? So the diameter of the blood vessel as well as the viscosity of the blood. So diameter of the blood vessel indicates what are the factors affecting the diameter of the blood vessel. So these two are the factors that will affect the peripheral resistance. Okay, so how does the diameter affect the peripheral resistance? So vasoconstriction, what happens in the vasoconstriction? There is decreased diameter of the blood vessel. So what will happen if the diameter of the blood vessel decreases? There is increased peripheral resistance. So if the diameter is less, that means the resistance is more, right? So peripheral resistance is more, that means BP will also be more. Okay, so by this we'll understand one thing, that BP is again directly proportional to peripheral resistance. More is the peripheral resistance, more will be the BP. Okay, in vasodilatation there is decreased diameter, right? Because of decreased diameter there is decreased peripheral resistance. Sorry, in vasodilatation, I'm sorry, in vasodilatation there is increased diameter, right? In vasodilatation it is increased diameter. So what will happen if the diameter increases? The resistance offered by the blood vessel will decrease. Because of that the blood pressure will be less. Okay, so this is how the diameter of the blood vessel, that is the peripheral resistance, affecting the BP. It is directly proportional. Now what is viscosity of the blood? Whatever the compositions is present in the plasma, that all contributes to the viscosity of the blood. So what does the plasma contain? RBC, WBC, all these hematological components which are present in the blood, they contribute to the blood pressure. How do they contribute? By some of the factors that affect the viscosity of the blood. So in polycythemia, what happens in the polycythemia? That is increased RBC count. Okay, that is polycythemia. Then what is hyperproteinemia? In the name itself indicates, that is increased protein content in the blood and the decreased temperature. So these three factors, they are going to increase the viscosity of the blood. Okay, now what are the factors that are decreasing the viscosity of the blood? Just simply remember, opposite to factors increasing the viscosity, that is anemia, that is decreased RBC count, hypoproteinemia, decreased protein count, and increased temperature. So this is the factors decreasing the viscosity. So if the viscosity of the blood is more, then BP will be more. Okay, so here viscosity is also directly proportional to, so BP is also directly proportional to viscosity. Okay, so if the viscosity is more, blood pressure will be more. If the viscosity is less, blood pressure will be less. Okay, so this is all about today's video, and follow part 2 to to cover the regulation of BP. In that we'll be discussing how the blood pressure is regulated. Thank you.